Today in the lab, we're going to be talking about pain management during labor.
For women.
Yeah, for women.
I just thought I would clarify.
Today's epidural is brought to you by Baby Bjorn and their brand new Baby Bjorn comfort carrier. Great for bigger babies. Baby Bjorn Architect certified, safe for your baby.
So in order to understand mom's options when it comes to pain management, we spoke to a couple of docs on the leading edge of obstetrical practice at the Rainbow Babies and Children's Hospital in Cleveland, Ohio.
Well, there's a couple of different options, and some women come to their childbirth experience wanting no pain management. And so I think for that person, the father's going to play a big role in trying to get them through what they can as far in the labor as they possibly can. A lot of our first-time parents come in who've never had a baby, and they really have an intent on having a natural childbirth. And I tell them that they should absolutely try that. They should come in here with the intent that they should try that and prepare themselves and try to get as much information as they possibly can, but to not lock themselves into it, because they really won't know what their story is going to be like until it unfolds here. There are some things that people can use who are not going to have an epidural in the interim, but when those things wear off, they have to realize that they're back to where they started.
There are several different types of pain management that are offered here on labor and delivery. From an OB standpoint, there's IV pain medications that the obstetricians order. From an anesthesia perspective, our main pain medication that we offer is an epidural. An epidural basically is when we place a needle in a patient's back, and through that needle we place a tiny catheter. The catheter stays in a patient's back and the needle comes out. Through that catheter we inject medication. The medication is a local anesthetic mixed with a narcotic, and that runs throughout the whole entire labor until the patient's delivered.
The epidural is taped in place.
So we tape it in place, and it's attached to a pump that goes continuously throughout the whole entire labor. We also provide that patient with a button that allows her to give herself extra medication if she needs a little bit more.
And the fathers like to push that for her.
Epidurals are nice because what they tend to do for the patients in labor is provide pain control without taking away the patient's ability to push. It numbs the patient from about the belly button to around mid-thigh. So it gives her pain control in the area where she's feeling her contractions, but it still gives her the ability to move her legs. Dad is usually there when we're explaining what the risks and benefits are of the what epidurals are, but we ask them to step outside behind the curtain. So he's there listening during the procedure, but he's behind the curtain so he can talk to his wife when we're placing the epidural, but he's not physically in the room.
And that's really more for the safety of the father. They sometimes get nervous when they see those needles, and they go down sometimes, and that's not unheard of. And then we're dealing with a situation where the father's just fainted and his wife is in the middle of an epidural. So most of the fathers are actually happy to step behind the curtain.
I think many patients, when they come in and say that they want pure natural childbirth, are under the assumption that epidurals slow labor, and so part of my discussion with them is to try to let them know that that's not really the case. That if they're in the active phase of labor, that epidurals don't slow labor.
But from the obstetrician standpoint, we obviously offer patients pain management with things like anti-inflammatories and narcotics. And a lot of times patients and their husbands have concerns about whether they can safely take a narcotic, if they're going to breastfeed or whatever, and certainly all the medications that we prescribe are safe. And even one of the things that sometimes parents don't realize will happen is they come in and they're quite uncomfortable, but she's in very early labor. And one of the things that we can do is actually give her some pain management to go home with, or actually sometimes we keep them in the hospital and we give them morphine to help them sleep. And not the husband, the mother. And everybody sleeps well. And sometimes they wake up in the morning and go home, but most of the time they wake up and they're finally in labor. And people are always surprised when we offer that morphine, in a pregnant woman, but it works very well for early pain management in an early laboring patient.
So, how did your wife go on this one?
Epidural all 3 times.
And you guys are cool with that? That was good?
Absolutely. You went naturally though, right?
Well, not exactly. The first one was emergency C-section, middle natural, and then that's also known as a VBAC, by the way.
Yeah.
And then our third epidural, but it was so late it didn't really count because he was born like 5 minutes later.
Which one did you like the best?
Well, my wife, definitely the natural childbirth. Me, I'd like a little bit more data on this epidural because it seems like I would probably like that a little better.
Yeah, probably.
But I don't get any choice.
Yeah, you don't get any choice, her choice. Well, we know that you have thoughts on today's episode, epidural or not. Go and drop a comment on this video or go to DadLabs.com and join the discussion over there.
And we want to thank our sponsor, Baby Bjorn, Ecotech certified, safe for your baby, Baby Bjorn. We'll see you next time here in the lab.